Hi, I'm Dr. Dhruv. I'm an endocrinologist, and I'd like to talk a little bit about heart healthy as well as good and bad cholesterol. When we're looking and thinking about the heart has four chambers. A top chambers called the atrium, that's the right atrium, left atrium, and the bottom chambers, the left ventricle, right ventricle, and left ventricle. Now, blood usually pumps from all of the body, comes into the right atrium, then goes to the right ventricle, gets pumped out into the lungs, gets oxygenated, and then comes back to the left atrium, left ventricle, and then gets pumped out to the rest of the body. Well, what we're actually looking at when we're looking at cholesterol, none of us really look at total cholesterol anymore. We have to look at what we call the good and the bad cholesterol. The LDL cholesterol is what we consider the bad cholesterol. We want that low. So LDL, L meaning low, that's a good way to remember it. The HDL is the high density lipoprotein, low density lipoprotein for LDL, high density lipoprotein for the HDL. You want that elevated. So again, H for HDL, high, you want that a little bit higher. Why is that? Because just like all organs in our body, the heart also gets blood supply. The red are the arteries that supply the heart, and the blue are the veins that take the deoxygenated, the not oxygenated blood out and then gets oxygenated again. So when we actually look at the heart, and we can open it up a little bit and see some of the chambers, this is sort of what we're talking about. As I mentioned, the right atrium, the ventricle, the left atrium, the left ventricle, and these little valves that are here that kind of help keep the blood up here and down here and vice versa. So when we're actually looking at cholesterol, we want to look at how we can best optimize our cholesterol panel. Why? Because high cholesterol, or the high bad cholesterol, the LDL, can cause blockages in vessels. It can cause blockages in the vessels that supply the heart, and that's what causes a heart attack. People can have 30–40% blockage, so blood flow can still go through. It's not until 80% is blocked that you need maybe bypass surgery or angioplasty, which is kind of like a roto-rooter trying to open it up, or most recently now, stents. Stents work very well. They're drug-eluting stents. There's actually stents that are put in there to kind of keep that vessel open, push that plaque to the side of the vessel so we can let the blood flow through, and those particular stents have little drugs in them that keeps that area open for longer periods of time. But we want to prevent that. We don't want to have this already. We want to actually prevent any of these blockages. And the best way to do that really is to start from young age. Youth, try to eat a heart-healthy diet. Well, what does that consist of? That consists of having fruits, vegetables, protein in the sense of chicken, fish, turkey. Some of the higher saturated fats are what we call red meats, pork. It may be the other white meat, but at the end of the day, it still is a pig. So pork chops, bacon will also cause increase in that LDL cholesterol. And then of course, fried foods. So the best diet I always tell my patients is a heart healthy to also compensate not only just with the types of proteins you have, but also the carbohydrates that we're eating. So carbohydrates, the simple carbohydrates are the sugars. So those are sugary sweets, cakes, cookies. The complex carbs are what we consider the better carbs, which are oatmeal, the brown bread, that sort of thing. I always tell people eat like the biggest meal versus the smallest meal. So I always tell them eat breakfast like a king, lunch as a queen, and dinner as a pauper. In other words, your smallest meal should be the end of the day. Nothing to eat after 7, and then try to make that the smallest meal. Throw some salad, throw some chicken, some protein in there as well. So that's probably the best advocate of just diet control. And we'll talk in another session just about diet modifications per se. But when we're looking at cholesterol, it's extremely important to understand what we're looking at when we're looking at those numbers. We talked about how to get rid of some of the LDL, by eating healthier. But how do we actually improve the HDL, the good cholesterol, try to make it higher? The only way to actually improve HDL cholesterol is exercise. So that can be all different forms of exercise. whether it's cardiovascular, rowing, bicycling, running, swimming, as well as weight training. So those things can actually improve HDL cholesterol. For our smokers out there, when people do stop smoking, HDL improves. That's not to say you start smoking and then your HDL will get better stopping it. We want to stop to begin with. But HDL does get better. HDL becomes very, very low in smokers. And you do see an improvement in HDL cholesterol with the cessation of smoking. That's sort of what we can do. Most of the cholesterol that our body has, the LDL cholesterol, is genetic. So 85% of your cholesterol is made by the liver. And the liver, the amount of cholesterol it's reconstituted is really by the liver, and it's genetic. So we see people, we all know people who are thin, young, who have high cholesterol. And then we also know people who are overweight, who have low cholesterol. But that 15%, we can make modifications for. So I always tell my patients, I'm not particularly keen on keeping the drug companies in business. It's a lot harder, but we can have a heart healthy diet to begin with. I also tell parents, I said there's a huge epidemic of obesity, and I do diabetes and endocrinology, so the highest incidence of type 2 diabetes in this country now is in children under 12. Remember when we were young, we were out playing all the time, and you don't even see children playing now. And if we do see children, we're thinking, what are they doing? Well, they're children. Let them go outside and play. So it is important to have these modifications of eating when they're young. Every child says, oh, I love my mom's cooking. It's not that the mom's cooking was so great. Mine, of course, probably is, but not, what I'm saying is not, it's just what they're used to. And having that foundation of their diet is so much more easier to maintain than changing huge diet modifications later on. Now, we don't want our child to be neurotic, of course. They're children, and they need to eat, and they need to grow. But things that are what I always consider, and I used to take patients through Publix to help read labels, is just to try to go in the areas around the grocery store and not to go within the lanes. So what you see that's outside in the grocery are things that are vegetables, fruits, protein in the sense of cheese and meat, and then yogurt, milk, and that's sort of what we see in the periphery. Those are the better foods to eat. The more boxed foods, the more other types of foods that are packaged and preservative rich are within the inner layers. So even when I tell people as far as heart healthy, eggs, eggs have a great sense of protein. Having said that, the yolk itself is very high in cholesterol. So it's important to perhaps, if you're going to do a hard-boiled egg, just take the yolk out. Or even if you do egg beaters, I found that egg beaters on the shelves, I naively thought that egg beaters on the shelves were just egg whites with yellow food coloring. It's not the case. Most of my patients have a blood sugars that are about 20 points higher when they make the same omelet with egg beaters versus if they just took the yolk out, used the egg whites, and made the omelet itself. Why is that? Well, if you think about it, those cartons of egg beaters have to have a longer shelf life. You can't imagine putting a whole bunch of egg whites in a carton and having that lifespan. And because it has to have that longer lifespan on the shelf, there are other things that are added to it that may raise the blood sugars. And anything that raises blood sugars in a person who is not diabetic, their own pancreas produces the insulin so we can metabolize it and use it. Well, when you're not using it, when you're not metabolizing it, it gets deposited as fat. So there's always a fine balance between what you're eating versus what you're expending. So I always tell my patients, they're like, I barely eat anything. I said, sure, absolutely. But look at Michael Phelps. The man eats more for breakfast than I do the entire month. But what he does is he's Olympic training, maybe 10 hours a day. And so he utilizes what he's eating a lot better. As we get older, a hormone called growth hormone, it's made by a small gland outside the pituitary, outside the brain called the pituitary, decreases as we age. So our metabolism does go down. So the same foods that we used to eat before don't have the same impact. So I do tell people that it is a fine relationship between the two. Men and women are different. How are they different? I always tell husbands and wives, please don't exercise together and eat together because the man will not eat as well as the woman, and the woman will eat much better, exercise more, and the man will lose more weight. Well, hormones do have a factor in it. And having said that, we as women become very much more carb sensitive. That carb sensitivity increases in our 40s, and after menopause considerably increases. So we do need to modify the carb content as we get older to more complex carbs and earlier in the day rather than at night. And so some of my patients are also like, well, I love having popcorn with a movie in the evening. And I said, fine, have the popcorn. But after the popcorn, utilize that popcorn. I don't care if your neighbors think you're crazy, just walk up and down the house and utilize it. And that's fine, not exercise the next day because now you've already increased your insulin production to try to metabolize it. So that's a short as far as a little bit about diet. We'll talk a little bit more in detail in another session, but I just wanted to give you an idea about heart healthy, lipid profile, how we can read the numbers. I've had lots of patients say, oh, my cholesterol is horrible, it's over 200. Well, don't look at the total cholesterol. Look at your good and bad cholesterol and the relationship between the two. I hope this was informative. Thank you very much.